The Old Colony Y is a cause-driven charitable organization that has been focusing on, for many years, the social determinants of health in the communities that they serve. So the health disparity effects that we see in these communities is when we look at the data about hospitalization in Brockton and Stoughton communities. In particular, in Brockton, we see a high rate of hospitalization around diabetes. The data shows that the rate of hospitalization we got for diabetes is twice that of the state. And when we look at the African American Black population, we see the rate of hospitalization 4 times the average of the state. So Old Colony got involved in public health along with otherwise across the nation. And we really wanted to focus on shifting the focus on the treatment of disease to more so about looking at how we can prevent those diseases from happening and looking at a community as a whole to giving people more access to care. Ultimately, we don't want zip code, socioeconomic status, or race to dictate people's health outcomes.
In 2014, the Old Colony Y, as the lead agency for the Healthy Communities Coalition, received funding from the Centers for Disease Control for REACH, Racial and Ethnic Approaches to Community Health. And what that funding has allowed us to do is really provide chronic disease prevention and management programs in Brockton and Stoughton, Massachusetts, with a specific focus on the Black and African American population. We learned from healthcare providers about some of the challenges they face when dealing with patients from other cultures.
The REACH Coalition is a group of probably 12 to 15 people from various organizations. We provide healthcare, we provide social services to Brockton and its surrounding communities. The cultural competency trainings that we held in the Brockton community, they were actually a series of 3 workshops that were provided over the course of the last year. And the purpose of the workshops was to give healthcare providers working in the community some concrete tools and strategies in order to incorporate into their practice so that we could better connect with the various ethnic and racial populations in our communities.
Our involvement in the coalition has benefited the patients of Signature Healthcare. You know, our president and CEO, Mr. Kim Holland, really is so focused on providing resources to the community. And so by participating in the REACH initiative, we've really been able to provide additional services to the folks from our community, such as those free screenings, setting them up with chronic disease self-management programs, and things of that nature, things that maybe they would not otherwise be able to do and take advantage of.
Brockton Neighborhood Health Center is a multicultural organization. We serve close to 30,000 patients. My patient faced many challenges. Transportation, which is a biggie right now, and immigration, socioeconomics, language barriers, housing issue, social isolation. They face a lot of challenges.
We also learned a lot about how much people rely on their church for health information.
You know, the vision of the church being as a community looking for comfort, for healing, for happiness, for the peace of Christ, the peace and the love that Jesus brings us. So it's in a certain way being healthy. You know, if you want to be good, to live in a good way, you know, that's the place to be.
I think because it's a community, when you have someone who is in a leadership role and calls them to live a healthier life, such as avoid smoking or getting exercise or eating the right foods, when that leadership person tells them that this would be best for you, I think they hear it differently than if someone, even a doctor, would say it to them. Because they have a sense of trust.
Our goal through REACH and the mission of the churches really align, and together, working together, we really holistically address the health of the community. So another great example of how this coalition works together is we were offering a program at St. Edith Stein, the My Life, My Health Chronic Disease Prevention and Management Program. That program had to be in Cape Verde and Creole or it wouldn't work, and we couldn't find any organization that had 2 trainers who could speak the language. Through the strength of the coalition, we were able to get 1 trainer from the Neighborhood Health Center and 1 trainer from the Good Samaritan Medical Center working together to provide the program.
My Life, My Health program, it is an evidence-based program, chronic disease self-management program developed by Stanford University. It is a 6 weeks workshop offered once a week. In this workshop, usually we cover many topics, for example, healthy eating, medication management, dealing with a difficult emotion, pain and fatigue management, and many other topics. The group setting, they motivate all the participants to support one another because it is very interactive program. People who were once depressed with their health, or people who in some point they lost control of their health, they are getting back on a better balanced lifestyle, becoming self-dependent, and they are creating a strong partnership with their healthcare providers.
We are already seeing incredible results. We have some very statistically significant results in terms of people reporting becoming more physically active. They are experiencing less stress, they are experiencing less sleep loss, and they're reporting less pain.
E muito agradecer pessoas, ou que seja oportunidade que se participe nesse programa, porque ele está China a maneira de comer, porque aquele não está pondo no nosso corpo, é aquele que está doençando. Mas nós não comer saudável, nunca tem problema, doutor. E exercício também aconselha tudo alguém para levantar nesse sistema um bocadinho de fio, buscar um ginásio que faz baixa ginástica, para não ter uma vida saudável e longos anos de vida.
Na saúde, se senti melhor bastante em virtude de andar a entender, ginástica, tomei medicamento mais saudável, estou dormindo melhor agora. Com um bocado de estresse, como sabe, de minha pai que morreu, mas se senti mais saudável com vida de saúde, graças a Deus.
This really is community integrated health, where we are taking traditional medical systems and we are combining them with community-based agencies like the Y to work together towards this common goal of community health. The relationships, especially with the clergy, are really key to the sustainability of this work.